me to introduce myself a little bit. My name is Loïc Notelet. I'm Patient Network Management Manager Europe for Sanofi. So previously I used to work in clinical operations for a few years, starting with adults and then moving to the pediatric trials. As such, I worked on a specific trial, and then I had a larger management role in the pediatric area of Sanofi, working on different therapeutic areas, notably rare disease. And now I have moved to another team which consists in engaging patients across European countries, which is shared with other colleagues around the world. And this is, for this team, the objective of our daily work, to collaborate, to interact closely with patients. So it's really a pleasure for me to present this section. I will concentrate on product formulation. You will see that when we say product formulation, there is already an ambiguity, since formulation can have a different meaning. First of all, well, I will not spend too much time on this. Ségolène has already introduced the general path of development of a drug. Here, maybe the point on which I will insist is here through this arrow, to show that the development of the formulation of the drug actually starts very early. As noted here, when a molecule is identified as a potential candidate for a therapeutic effect, almost immediately behind, what we need to know is what the drug is first, how it can be characterized by chemicals, by biologicals, multiple characteristics, but also, of course, to make sure that when I say we, of course, it can be all kind of companies or entities that want to produce this drug, is to make sure that there is a technical ability to produce. As you can guess, it's great to have a candidate molecule for therapeutic need, but of course, if there is no possibility to make a drug from this molecule, unfortunately, it may fail to go further. So there is really a need very early to make sure that there are technical abilities, that there is a possibility to produce the drug in quantities, in large quantities, so that it can be in the future provided to the whole population. So this manufacturing, industrial development starts very early, to make sure that we can have a suitable form which can be given to a patient, and then all along the... So this manufacturing, industrial development starts very early, to make sure that we can have a suitable form which can be given to a patient, and then all along the clinical trials, all along the development, it's a recurrent activity to further characterize, to produce larger and larger quantities, and eventually also to explore, to investigate some alternative forms which can be given to the patients. Yeah, thank you. So yes, I mentioned a little just before the ambiguity, which relies when we say formulation, form. So here, the thing is that actually formulation may be a little bit misleading. And if we refer to the definition of which can be provided, for example, by the EMEA guideline, a formulation defines the composition of a particular dosage form of a medicine for pediatric use. So, of course, here I focus on pediatrics. So they make a distinction between formulation, which is a composition, and the form, the dosage form, which will be the actual product given to the patient, to the child. And then a second definition they provide is that a pediatric preparation is a formulation in a particular strength. So this is finally the dosage form, which is a preparation with a branded name as we know them, which is marketed and prescribed by patients. So one thing also, further to what Ségolène was saying in terms of study design, obviously the study design of the study design takes the product or the dosage into account. It's obvious that it will greatly influence the route of administration, whether the drug is given orally, by intramuscular, IV, or whichever form which is used. The dose regimen, of course, because as you can guess, the drug will be given on a daily basis to be taken every morning, on a weekly basis through an injection, with another regimen through an infusion. So there can be multiple ways to administer the drugs. And of course, the study design will take this into account, and it will create a number of visits, a number of study drug administration, which will greatly participate to how the study can be designed to administer the drug and to take into account this into the study conduct. The form will also influence because of the sample size and the definition of treatment arm.